before we get into tonight's video, let me introduce you to my other ASMR channel, BeHastyASMR. On that channel I provide lo-fi fast content. If you like anything fast, unpredictable, chaotic, fast and aggressive and funny ASMR roleplays and ASMR trigger videos, this channel is for you. You can find the link in the description box below. Please head on over, subscribe and check out my other videos. I am on the way to 100,000 subscribers. We have a long way to go, but I would love to have you on this journey with me. Thanks so much. Please enjoy tonight's ASMR video. Hello, lovely. Are you okay? What's wrong? You're having some tummy problems. Alright, let me just get my pen and paper, my love, okay, so I can take some notes. Okay, right, so can you just elaborate? So when you say pain, are we talking mild, moderate or severe? Okay, so severe. On a scale of 1 to 10, 10 being the worst pain ever, where would you pop the pain? Okay, so that is very severe. Alright. So, when did this first start? Okay, so quite a few months ago, really. I'm talking about half a year or so. Yeah. Now, did it start suddenly or was there a gradual build-up? Okay, so maybe gradually you had the odd tummy ache and then about 6-7 months ago, it stepped up a notch. Okay, that makes sense. Alright. So we've been experiencing diarrhea, bloating, excessive wind and obviously pain. Now, how often are you experiencing these problems? Oh wow, so that's quite a lot. Okay, so it's a daily struggle. Yeah. Do you ever get constipated? Okay. Wow, that's a long time. Okay, so you're going to the toilet once a week, unless you get an irritated stomach and then you have a lot of diarrhea but a lot of pain. Okay. Do you ever feel like you need to go to the toilet in that week? You don't? Okay, so you're not having that horrible heavy constipation pain or feeling? No, so you just don't need to go. Okay. And then when you go, is it okay? Okay, so maybe a little bit uncomfortable. Okay. Okay, unless you have diarrhea. Okay, and that gives you obviously tummy pain. And how many times are you going to the toilet when you're experiencing the diarrhea? Oh wow, okay. Okay, that's quite a lot. And again, it does vary. Alright. Okay, so you're experiencing a lot of pain and you can't necessarily go to the toilet, and then okay, then you get severe cramping and then you'll go. Okay, right, that makes sense. Okay, now I want to go back to the beginning. So when this first started, what was happening in your life? Was there anything in particular that could have triggered something off? Did you have a stomach bug, flu, or anything like that? Was there any stress in your life? Okay, so just pretty normal, really. Nothing kind of set it off. Okay. Do you remember the very first time, or is that pushing it a little bit? In case you can't quite remember, you just know you're getting some cramps and... Okay. Can you describe the pain? Okay, so like tight squeezing, pulling, kind of contraction type pain. Alright. Okay. Do you ever get any nausea or vomiting? Okay. Okay, well that's a good thing. Okay, now, when you had the diarrhea, is it instantly like water, or is it a gradual? Yeah. Okay, you poor thing, that doesn't sound very pleasant. Okay. Okay, that's fine. Now, did you have a change in your medication around that time? Let me just double check. No, so you've been on the same thing now for quite a while. Yeah, so that won't make any difference. Okay, that's fine. Right, so is this every time you eat? Mm-hmm. Yeah. Okay. That doesn't sound very pleasant. No, especially if you're starting to worry about eating, that's going to make you feel unwell. That's probably not going to help and make it worse. Now, have you tried eliminating foods? Okay, so you have, okay. So what things have you kind of changed up? Okay, so... Yeah. Okay. So is it certain foods that guarantee every time to upset you? Okay, right, so not necessarily. Okay, so maybe if you have something too rich, yeah, too fatty, okay, maybe too much cheese, too much chocolate, too much caffeine. Okay, so possibly irritation around those, yeah. Okay. Now, have you tried not having any gluten? Okay, so you haven't that, yeah. What about coming away from dairy? Have you tried like maybe lactose free or a little bit? Okay, you're not, yeah, okay, so it's not particularly helping much. I mean, it does sound like you've got irritable bowel syndrome. That is what you're describing. However, there could be an underlying issue. You could have a bowel disease, something like that, or an allergy or an intolerance, okay? Yeah, I will have a feel around your tummy in a little while, okay? Yeah. So I suspect IBS or an IBD. but obviously I can't diagnose anything other than irritable bowel syndrome. You'd need to see a gastroenterologist for that, my love, okay, and have some further testing. Yeah, I mean, you say you've done some eliminations, so that's usually kind of one of the first things that we get you to do. And have you done a diary? Oh, you have. That is perfect. You might just pop it on the side for me and I can have a look. I like that you're very on board there, so that's really helpful. Oh, did they? Oh, that's good. I'm glad. It really helps speed things up, you know, rather than me getting you to do this and come back. Yeah. Okay, so I'll have a look at your diary in a moment. Okay, and then I can get an insight to what your diet is like. Now, do you exercise at all, my lovely? Okay. Okay. So would you say then day to day can be quite different and you don't necessarily know what's going to trigger it off? Okay. And then there's some things that you think definitely will. Okay. Alright. Would you say there's any foods in particular that you would always get tummy ache? Okay, it's a very awkward one, isn't it? It's quite complex, that. Yeah. Have you ever had any issues with your bowels before? So this is totally new. Okay. What about your family? Has anyone in your family got any issues? Okay. Now let's just have a look. Now I know that you have mental health issues, which sometimes obviously when we get anxiety and that can obviously irritate our bowels, but that has been going on for a very long time and this is very new, so I don't necessarily think the two are related. I don't think it helps, especially if somebody has IBS. Anxiety can actually make it worse. Okay, so there can be a sort of a link there, but it wouldn't be the causing factor. We don't really know what causes IBS or some bowel diseases. They just start as anything does. Sometimes they are linked to a certain health condition, but not always. Okay. Now, what you've described to me does sound like IBS, but we haven't had any tests done, so for now I'm going to diagnose you with that, but I suspect something else is going on. Alright. Yeah, when you go to the toilet, what is the consistency like? Okay. Okay. With the mucus, is that every time? Okay, and what kind of colour is it? And what's the texture like? Okay, thank you. Do you ever see blood? Okay. Have you ever experienced hemorrhoids, piles? Okay. Thank you. Right. Do you ever get any pain through your anus? Okay. Sometimes you might get a shooting pain up there. Okay. Sharp shooting, okay. That's fine. Yeah, I know people can get a little bit uncomfortable when we're talking about poo and bum and digestive system and all things like that, but you know, it's normal, isn't it? We all need to go to the toilet, and I think more people need to talk about it to make it more normal. It's always a little bit of a, I don't know, like a taboo, isn't it, about needing to go to the toilet. And I mean, I'm talking like, you know, this, and I get the same. Yeah, I'm always feeling like, oh, I don't want to go to the toilet here. It's like a constant thing, and you know, especially because I struggle with my bowels as well. I've got IBS, so I can sort of relate to what you were saying. Yeah, and I feel like more people need to speak up and talk about the toilet. Yeah, you know, I mean, you hear people talk about, you know, water infections, kidney infections, etc., but, you know, shy away from talking about our bowels. Yeah, you know, and they can cause a lot of pain and a lot of problems. But here is a safe space and we can talk about it, alright? You've given me so much information, which is really grateful because that's really helpful. Alright, yeah. Exactly, and I feel like people need to be more open about it. I mean, I could see when you were coming, when you started talking to me, you seemed a little bit anxious about talking to me, and I'm a doctor. Exactly, and then, you know, God forbid if we talk to somebody else about it. But, you know, more people need to speak up. Yeah, you know, because I think you'd be shocked at actually how many people experience issues with their bowels, whether it's constipation, whether it's diarrhea, whether it's food allergies or food intolerances or bowel diseases or other issues. Yeah, exactly. But, you know, you've come to me now, and, you know, we're on the right step to sorting out what's going on. Alright, so going over your symptoms, it does sound like you've got irritable bowel syndrome, but I am wondering if you may have a bowel disease or something like that. Now, I'm going to have a little look through the diary just to see what kind of things you are eating. And, you know, I like the way you set this out, what you've eaten and how your symptoms were. I like that. Thank you. Okay, so you do quite have a good mixed diet there. Exactly, you know, we should be able to eat what we want. Yeah, I can't really see a pattern here. No. Yeah, I'm not really seeing a pattern. I'm going to keep that. Yeah. So, yeah, not particularly a pattern, my love. That's what makes me think it's probably something a little bit more going on than just maybe irritable bowel syndrome. I mean, you know, you could just have that, didn't, you know, I mean, have you tried anything like Buscopan? Okay, you haven't. Did that help? Okay. Okay, so you have been taking Imodium if it gets too bad. Okay. Yeah, and then you can get blocked up. Yeah. What have you been doing for the pain, my love? Okay, so hot water bottle. Okay. Pain relief, and you had anti-inflammatories, and you don't really see much of a... Okay, alright. Okay, alright. Okay, I'm just going to have a feel around. Alright. And I'll have a listen to your tongue as well. Do you find it rumbles a lot? Okay. Okay, my love. Can I have a feel? Okay. When was the last time you eaten? Okay. Okay. Okay, can you breathe in for me and hold your tummy in? Okay, relax. Okay, can you cough? And again. Okay, I'm going to press deeper. Just let me know where the pain is, my love, if there's any at all while I'm touching. Okay, I can't feel any hernias or lumps or anything like that, which is good. There's nothing obvious. Okay, maybe slightly a little bit bloated. Okay. Okay. Okay, I'm going to have a listen now. Okay. So it's very gargly. It does make a lot of noise. Okay, I'm just going to check your pulse if I can have an index finger, my love. I like to just carry out a few checks as well, just to make sure everything's okay. Okay. Pulse is a little bit on the fast side, but if you're feeling a little bit anxious, that could explain that. Oxygen level is perfect. Okay. And check your temperature just to see that there's no infection or anything like that. Okay. Okay, I'm going to check your ear. Okay. And the other side. Definitely don't have a temperature, which is great. A pretty consistent temperature as well. Okay, if I can just get you to open your mouth for me and have a little look at your throat and tongue. Say ah. Okay, pop your tongue out. Okay, relax. Have you been having any ulcers? Okay. Any cuts or anything like that in your mouth? Okay, that's fine. Tongue looks a little bit on the dry side. And the throat looks fine. Okay. Right, so my love, what I need you to do is do me a stool and urine sample. Okay. reception will be able to give you the correct tubs. Okay, if you just ask them. Okay, so you need to do them. Instructions will be in the pack, and then you can get them dropped off as soon as possible, and then they can go off for testing. Okay, need to get you in for a blood test. There's quite a lot of things that I would like to check for. Okay, I've got you a diary, so that is done. Diary is done. Obviously today consultation is fine. Okay, I would like to get you in for a ultrasound scan on your tummy first, and I think we need to refer you to a gastroenterologist. Okay, yeah, there's not a great deal that I can do. I can give you Buscopan, Imodium, and things like that. Okay, but you need further testing. I mean, you've done great on doing your diary. We've done a good, thorough consultation today. And listening to your tummy, it's definitely, it's not happy. You know, you're a little bit on the bloated side. Right, can you just pop on the scales for me so I can check your weight? Thank you very much. You can sit back down. I'll just check. You've lost a bit of weight. Have you been trying? Okay, I mean, obviously I haven't seen you for a while, but from what we've had on the system, it's quite a significant loss. I mean, you look fantastic, I might add, but, you know, and you are still in the normal range, so that is okay. But just because you've lost a lot of weight and you've not been trying, you know, that does concern me. Okay, so I'm definitely going to get you referred. Okay, so urine sample and stool sample, we need to get that done, like this week would be great. Okay, blood test, I'm going to try and get you in. I'm hoping someone's available today. Ultrasound, we should be able to get you one of those done in a couple of weeks, and then obviously I'm going to refer you on. It's up to you whether you want to go on the NHS or go private. There is going to be a wait if you do on the NHS. Okay. Okay, that's good. Okay, let me just have a look, see if I can get you in blood test. Okay, we can get you in today, but you'll have to wait half an hour. Would that be okay? Perfect. Okay, let me just book you in. Right. Tick what I want you to get done. I'm also going to check your hormones, okay? Okay, I'm checking for quite a lot of things, okay? I wanted to make sure I did a thorough blood check, okay? And then if the gastroenterologists want others done, then they can do their own, okay? Okay, so that's booked in for you for half an hour's time. Okay, so that's done. Right, so I'm just going to pop a note to reception, alright, just so they can get your urine and a stool sample kit ready. When you are finished, if you just go to reception and just say collection 4 and then give them your name. Okay. Okay, that's requested. Now let me see if I can book any ultrasounds in. Should be able to get you booked in via my system. Okay, so I'm just going to send a note to reception so they can get your urine and a stool sample kit ready. When you've finished here, if you just go to reception, just say collection 4 and then say your name and then they'll give it you. Okay, you're welcome. Okay, that's requested. And now I'm just going to see if I can book you in the scan. Are you quite flexible? Okay, well I can tell you the next slot and then you can see if that's any good or not. Okay, I can do Friday at 2 PM. Yeah? Okay, good. Book that in for you. Lovely, that's all booked in for you. Right, so do you have any questions for me? Okay, well, I feel like I've got a good picture. We sort of know what's going on, and get all these little checks done, and I will also get my secretary to do the referral letter for you and get that sent over and try and get you pushed through as an urgent. All right, my lovely. I can have a little look, just bear with. It's probably quite a while. Okay, I'll do that for you. I'll just jot the notes and they can read it. Lovely. That's all done for you. You're welcome. So my love, you know, in between now and then, you know, keep making a diary and, you know, put down how you're feeling, what you've eaten, etc. Okay, just as you were, and just monitor things, alright, and just continue as normal. Alright, my lovely. Okay, and then go and get your blood test done in a little while, pick up your samples, get them in ASAP, go and have your scan, and then in that time you will have a referral done for you. Alright, and then we can get things moving. You're very welcome. You take care now. Bye bye.